Hello, it's Dr. Berney with a message to our expecting parents out there. We understand how anxious you are right now as we work through the COVID-19 pandemic. Rest assured, the hospital and clinics are in constant communication to ensure our healthy patients remain healthy. You and your newborn baby will be safe and secure. Here are some common questions that may be going through your mind. If you do test positive for COVID-19 while pregnant, the best thing you can do is talk to your provider. So far, it doesn't appear that it would be any worse than many other respiratory illnesses that we already encounter. We will work with you to develop an individualized care plan since each expecting mother is different. Research is currently underway to understand the impacts of COVID-19 infection on pregnancy women. Right now, there is no evidence that pregnant women are at any higher risk of severe illness than the general population. However, due to changes in their body and their immune system, we know that it is possible for pregnant women to be affected by respiratory infections. It is extremely important that you take precautions to protect yourself against COVID-19 and report possible symptoms such as fever, cough, or difficulty breathing to your healthcare provider. Pregnant or not, now is not the time to go out in public. As with all other parties out there, we would feel much better if you would stay home and protect yourself and socially distance yourself. Family Medical Specialties and Phelps Medical Group have added an acute care clinic at Phelps Medical Plaza. This separate location provides distance and separation to increase the safety of all patients and staff. In order to provide regular scheduled well care visits, both clinics are using their offices for well-based services and are referring all infectious or potentially infectious patients to the new acute care clinic or to a telehealth visit. Phelps Memorial Health Center has taken a number of precautions to ensure your safety. First, only authorized visitors are allowed in the hospital. Your birthing coach can be at your side the entire time. They will be screened every time they enter the building. We ask that they remain in your room and not roam the halls. Meals and beverages will be delivered by our Terrace Cafe team to your coach upon request. Second, our employees continue to self-monitor for COVID-19 related symptoms. To further limit exposure, many of PMHC's employees are currently working from home. We have also placed travel and gather restrictions on our employees to minimize their exposure when it is essential they leave their home. Third, all elective procedures have been postponed. This limits the number of patients and visitors entering our building. It also reduces the chance of exposure to our essential patients and employees. Absolutely, each new mom will be able to have one support person. It is important that you follow the recommended guidelines from the CDC. Limit your exposure to others. We know it's exciting and people want to see your baby, but it's not safe for anyone at this time. Use technology to show off your new bundle. Wash your hands often with soap and water for at least 20 seconds per CDC guidelines. Always cover coughs and sneezes. Clean and disinfect frequently touched surfaces daily. All of our patients' rooms have windows to the outside. We've added room numbers so that friends and family can come visit outside with you and your baby safely behind the glass. We do not know if pregnant people have a greater chance of getting sick from COVID-19 than the general public, nor whether they are more likely to have serious illness as a result. Based on available information, pregnant people seem to have the same risk as adults who are not pregnant. However, we do know that pregnant women have had a higher risk of severe illness when infected with viruses from the same family as COVID-19 and other viral respiratory infections such as influenza. The World Health Organization is working diligently to answer these questions. At this time, we still do not know if a pregnant woman with COVID-19 can pass the virus to her fetus or baby during pregnancy or delivery. To date, the virus has not been found in samples of amniotic fluid or breast milk. There does not appear to be any vertical transmission that we can find at this time. Will breastfeeding be dangerous for my newborn? At this time, the virus has not been found in samples of breast milk. However, we do not know for sure whether mothers with COVID-19 can spread the virus via breast milk. If you are sick and choose to direct breastfeed, you should wear a face mask and wash your hands before each feeding. If you are sick and choose to express breast milk, a dedicated breast pump should be used and properly cleaned after each use. Phelps Memorial Lactation counselors will be happy to assist you. I hope that I was able to answer some of your questions and relieve some of your concerns about you and your new addition during this time. If you have any questions, please give us or your healthcare provider a call. We want to make sure that you are confident and have the best plan in place to care for yourself and your baby. Thank you and take care.